In this video, we're going to be looking at family therapy as a psychological therapy for schizophrenia. Now, unsurprisingly, family therapy is a family-focused psychotherapy, and it actually refers to a range of different psychosocial interventions. Which we'll be looking at in this video. So family therapy has links to theories of family dysfunction, including schizophrenogenic mother, double bind theory, and expressed emotion, which you've learned about as psychological explanations for schizophrenia. And so this therapy assumes that family dysfunction plays a role in the development of schizophrenia, but also plays a role in treatment and plays a role particularly in relapse. And so family therapy acknowledges that for different therapies for schizophrenia to be effective, that's really going to depend on the relationships with families. If a schizophrenic patient has poor relationships in their family, then that's going to lead to poor outcomes. And so family therapy aims to improve the success of various different treatments for schizophrenia. And part of this therapy is about recognizing the emotional toll, recognizing the burden of caring with somebody with a severe debilitating mental disorder like schizophrenia. And so there are a number of different aims of family therapy. One of the key aims of this type of therapy is to increase positive communication. So we're trying to reduce the level of expressed emotion in the family, because we know that expressed emotion has long been recognized as a really robust predictor of relapse. So if we can reduce levels of expressed emotion and if we can improve positive communication within the family, then that's going to help prevent relapse. Part of the aims of family therapy is also to reduce feelings of anger and guilt, to increase tolerance, to decrease criticism, because that can play a role in leading to stress. We want to reduce the stress in the household because we know that stress can predict relapse. So if we can reduce feelings of anger and guilt, increase tolerance, then that's going to help reduce the stress, and that might help then prevent relapse. Family therapy also aims to educate family members to be able to maintain appropriate and realistic expectations and limits of the sufferer. And so it's quite often family members might think, well, why can't they just get better? Why do they refuse to take their medication? And that kind of anger and hostility and resentment can lead to stress. And so if we can educate family members about the disorder and about realistic expectations for improvement and success, then they might be more tolerant, and that's going to improve the communication, reducing stress, preventing relapse. A large part of family therapy also involves searching for methods to solve problems to support an individual with schizophrenia. And so some of the practical problems that could be helped through family therapy could be, deciding who's going to be responsible for different aspects of day-to-day care, who's going to be responsible for overseeing adherence to medication, for example. And so if we can overcome some of those practical problems, then it means that when they arise, they're not stressful because they've got strategies to cope with them. If people have these everyday hassles that they can't deal with, then that's going to create stress and perhaps lead to relapse. So in terms of sort of the practicalities of family therapy, when we're talking about the family, that's really just a simple way of explaining anybody who has a significant emotional connection to somebody suffering from schizophrenia. So that's a little bit more sort of all-encompassing, but we just refer to it as the family. Anybody who's got that significant emotional connection, they should be involved in family therapy. Family therapy is a long-term treatment, 9 months to a year, or it might be ongoing actually with schizophrenia. It might not be particularly frequent, but it should be ongoing. And in family therapy, there's a real emphasis on openness. There are no details that remain confidential. Everybody has to be completely open and completely honest with one another. And family therapy provides a safe space to be able to talk openly and to express feelings. So nothing can remain confidential here. The patient is really encouraged to talk openly about their feelings, about what works, what support is helpful, what's not helpful, and everyone's encouraged to talk and listen and support one another. They're really encouraged to sort of clarify their emotions, so everybody really understands what people are thinking and what people are feeling. And so they might talk about their concerns, they might talk about their challenges, they might talk about their hopes, and all of that just needs to be as open and honest and authentic as possible. They often help family members understand how their behaviours impact on the person. So when we're talking openly about what support helps or not, the person with schizophrenia is likely to talk about the impact that has on them. And likewise, their family members are also given a safe space to be able to talk about why they might behave in a particular way or why they might engage in particular patterns of communication. And together, they're encouraged to really explore how they can work together to make positive changes. In a more practical sense, the family are often taught how to solve problems and taught how to, delegate different tasks, to talk about what resources, particularly time, they have available and what they can and what they cannot contribute to helping the person. Sometimes that's a significant source of stress. For example, if we think about expressed emotion, there might be too much responsibility on one person. They might be giving up, work. They might be giving up social interactions to care for the person with schizophrenia. And actually that over-involvement is a negative thing. We know that can lead to relapse. And so being able to talk openly about what people are taking on and what they can give up helps not just the person with schizophrenia, but also actually helps the family cope as well. And so some things that they might do is come up with this sort of family therapy map. And this is just a helpful diagram. This is the household of the people with schizophrenia. We can see everybody named there. And we can see that Kay, Kim, and Joe are going to be responsible for the school aspect. And healthcare, that's going to be the responsibility of this family member here. And so if we can sort of delegate responsibilities, then it means that nobody's overburdened, and it means that everybody's also involved and feels empowered to help. And that can be really useful to reduce stress as well. And then finally, skill acquisition is a really important part of family therapy as well. So quite often families will be taught skills for example, dealing with stress, or how to talk to one another, how to raise concerns in a non-judgmental and a non-accusatory way, how to listen to one another, so learn skills in active listening. And these skills can therefore be implemented once the therapy has actually ended. And so family therapy, while it's ongoing, the aim is to just develop new patterns of communication, develop new habits in the family, which are going to help rather than hinder the treatment of schizophrenia. So in terms of evaluating family therapy, so we're going to really be looking at 3 trains of thought. Research support we will look at. This is an empirical method. So this is based on research, and the research is ongoing. So it is based on research evidence. We're going to be talking about the cost effectiveness, and I'm going to ask you guys to do a bit of thinking here about why this might be a beneficial, cost effective, good investment when treating schizophrenia. And we're also going to look at evidence for the interactionist approach. This study by Guo, we're going to be looking at a number of times in this topic. But some other things to just consider, these are more, counter-arguments rather than fully developed pure paragraphs. But family therapy can be really useful because it doesn't require the same motivation, it doesn't require the same insight into your own thoughts. It can be really useful for patients that have very severe schizophrenia because it's using the whole family and it's focused more on practical elements and communication. It can be a bit more effective than CBT. It's rare to prescribe this instead of CBT. It's usually prescribed alongside CBT, but it can be useful for patients who have such strong positive symptoms like delusions and hallucinations where they might not be able to engage in CBT. They might have more success with family therapy. And a limitation is that focus on openness. Nothing can remain confidential. Everybody needs to talk completely openly and honestly about their feelings and their behaviors, and that can sometimes be problematic. So for family therapy to be effective, everybody needs to buy in, and everybody needs to be completely open and honest. And actually, sometimes we might see that family members are reluctant to share sensitive information. Maybe they don't want to be honest about how they're feeling for fear of repercussions. And actually, holding back can become really evident and really obvious, and that can lead to tensions and stress. And so anytime family members don't fully buy in or don't fully express their thoughts and opinions openly and honestly, that's going to hinder the success of treatment. But let's focus on our three main lines of thinking here. Let's start with research support. So in this research by Farrow, this was a review of 53 randomized controlled trials. Now this is kind of the gold standard of research, where we have participants randomly allocated to either a control or an experimental condition. And this was across Europe, Asia, and the USA. And so we're looking at sort of cross-cultural research here. They considered family therapy to standard care. Standard care, there is no real standard care. Typically, it refers to antipsychotic medication, but standard care just refers to what people would normally receive if they went to a GP or a psychiatrist for diagnosis. What is the standard or typical treatment in that area? So they compared family therapy to this standard care, and they found the following. They found that family therapy increases compliance to medication. It means that people are more likely to stay on the antipsychotic drugs, and that's a good thing. We know that antipsychotic drugs work, but we know that 74% discontinue treatment within 18 months. So if we can keep people compliant, keep people keeping up with that medication regime, then it's going to lead to benefits. It's going to lead to lessening severity of symptoms. And that's related then to this second benefit of family therapy that Farrow found, is that it reduces relapse by 50 to 60%, not just during the family therapy, but in the 24 months after therapy as well. So not only does it reduce relapse during, but it actually, because it it allows families to practice practical strategies, these can be implemented long after the family therapy has ended. And there's mixed evidence, so it's not as strong, but there's some evidence showing that family therapy improves mental state and improves social functioning. By social functioning, we mean things like being able to live independently, staying employed, having interpersonal relationships, and so on. So there's some evidence, not as strong, but there's some evidence that it also actually helps improve symptoms and the functioning of schizophrenic patients. And as a result of this, the NICE, the National Institute for Health and Care Excellence, these are the body that issue the guidance based on empirical evidence on the best course of action for various disorders. They recommend family therapy for all schizophrenic patients. That is the recommendation in the UK. So some pretty good evidence there suggesting that family therapy is better than just standard care. But there are some problems with this research and research into family therapy in general. And that's looking at what family therapy is actually doing, how it's actually working. It seems like the main benefit of family therapy is just to increase compliance with medication. So in that case, it seems like, well, it's the antipsychotic drugs which are actually working here to reduce relapse, to support social functioning, rather than the family therapy itself. So I guess you could argue that that's not really a limitation. If it works, it doesn't really matter how it works. But I think it's just something to consider, is that it may not be the therapy itself which is having an effect on symptoms, but it's almost having sort of an effect on the drugs, which then is improving symptoms. So just something to discuss there. Okay, let's have a think then about the cost effectiveness of these therapies. And I'm going to ask you guys to do some of the heavy lifting here. Some evidence suggests that family therapy is cheaper than standard care, which is usually antipsychotics, by about £1,000 for a patient over 3 years. So it's a relatively cost-effective treatment, and it's considered to be a good investment. So I want us to have a think about why this might be. Where are those costs being saved? What are the other economic implications of using family therapy? Why is this likely to be a good investment, and why is it therefore recommended to patients that have schizophrenia in the UK. So I'd like you to have a think about reasons why. What are the cost savings that come with prescribing family therapy? And why is this going to be therefore an economic solution, or at least an economic advantage when treating schizophrenia? Now, finally, we know that just treating the biological aspects or just treating the psychological aspects of schizophrenia alone isn't enough. We know that an interactionist approach to treatment is the most effective way of dealing with this disorder. And so in this research by Guo, this was a randomized controlled trial, again, that gold standard of research, of a clinical sample of about 1,200 patients with early stage schizophrenia. They had participants randomly assigned to one of two conditions, either antipsychotic medication only or antipsychotic medication plus 12 months of psychosocial intervention. And this psychosocial intervention consisted of a number of different strategies, including family therapy. Notice that we also use Guo as evidence for the effectiveness of CBT. So patients were either just receiving drugs or receiving drugs as well as various psychosocial therapies. And they found that patients who were receiving both antipsychotics and psychosocial intervention, they were more likely to continue taking their medication. They were less likely to relapse. They had improved insight into their disorder. They had higher quality of life and increased social functioning. So it seems like a combination of both bio and psychological treatments is leading to the best outcomes for patients with schizophrenia. So this is why NICE recommend a combination of antipsychotic medication plus CBT plus family therapy when treating schizophrenia in the UK.